TRUUD's all about health and the built environment. A very, very high proportion of the population live in cities and towns, and how those towns are built and how they operate has a tremendous effect on the health of the population. Sometimes for good and sometimes for bad, and what we're trying to do is shift that balance so that towns and cities become really healthy places for people to live in.
The goal is to have impact on policy and practice that can incredibly reduce non-communicable diseases. Things like cancers, diabetes, mental health.
Welcome. There's a very great opportunity that we've now got an amazing, rich amount of data from people in the space of urban decision making, which is an incredible resource that we're now going to exploit, or you are exploiting.
Greater Manchester has pretty serious health problems which affect not just the individuals who suffer from them, but the performance of the conurbation, its economy, its society. Streets for All is just a different way of looking at streets which puts people's health and well-being at the centre of design rather than speed of traffic and all the other things that are important.
By looking at transport, we can actually look at a range of different diseases where active travel can actually have a much bigger impact than anything that we do as doctors prescribing medication. What we're seeing in all of these preventative type of interventions is that we'll see the impact now, but it's going to carry on over the next 5-10 years, really making a difference on health inequalities.
I am a researcher in residence on the TRUUD project with Bristol City Council. I work as part of the regeneration team on a big regeneration project that's happening quite central to Bristol. The project's called Frome Gateway. It's an area that currently is designated as an industrial warehouse area, and in the emerging local plan it's going to be changed to mixed use or residential led probably. Thousands of new people will move into that area. The council project is trying to bring together many different stakeholders to try to develop a framework of what that area will look like. One of the bits that I'm working on with TRUUD researchers is looking at how we can look at the scenario testing for the framework. We're working with consultants and architecture firms to help us develop different scenarios of what this place might look like. So if we have 3 different scenarios, I'm working with colleagues in health economic modelling, and we can say what are the health impacts of these 3 different scenarios, and if we can put a monetary value on these different aspects, how does that influence decision making? So my role as an embedded researcher, I'm in a position to then partly connect those researchers and people in practice, but also learn and say, well, does it actually make a difference? What impact does this monetary value have? Or how can we tweak that modelling to make it more influential so that we can say these are the health impacts? Say if you had more green space or you had different types of housing, that kind of thing.
Things get built or demolished or changed all the time. What we're talking about, it really is doing it better, doing it in an integrated way so that everyone gets the benefits, and we do it together so that we produce integrated transport systems, we produce better air with more physical activity opportunities for everyone, and we live in healthier, happier places.